Welcome to Oakdale ObGyn, where you have the option to work with a certified nurse midwife for your OB and GYN care. Nurse midwives are advanced practice nurses who bring specialized education and training in women's health. As part of our medical team, nurse midwives are committed to helping women in all stages of life stay healthy through well woman care, annual exams, birth control, pregnancy, and labor and delivery.
Certified nurse midwife is an advanced practice nurse practitioner who has gone to school to get an advanced degree in nursing. Usually they go through a 4-year RN program and then they go on to get their master's or doctorates. There's different programs out there that have different requirements. We are trained specifically to take care of healthy women during their lifespan, really, going from teenage years up to menopausal years. And Oakdale ObGyn specifically see women to about the age of 45. So we will start with when they're teenagers, if they would need birth control or just education about their bodies, up through pap smears, GYN visits. Pregnancy is what most people think midwives do, is deliver babies, and that's a huge part of our practice, but we see women through their lifespan, really.
I would say a lot of women who are interested in more individualized, holistic care gravitate towards midwives. Our visits are longer. We're able to provide more education about labor, birth, pregnancy, what to expect in the next couple weeks before we see you again, and able to develop more of a relationship with you and your family members. I think that's kind of a really fun component as a midwife, that we're able to develop those relationships with our patients.
The partnership between the Oakdale ObGyn physicians and the nurse midwives that we have, it's a working partnership. It really is where one is not separate from the other, which I think is very unique in the programs that are out in the state of Minnesota. A lot of the programs other than ours create a division in the two groups, even though they may work with a physician group. So I do believe that our group is special in that regard. We have a true collaboration, a partnership, and we want to have really no separation in that.
When you choose to work with a nurse midwife, you can expect longer appointments that allow more time for questions and education.
I think the benefits of working with a nurse midwife is that it's a comfortable, casual feeling. It doesn't feel like kind of white coat syndrome. You feel like you're talking to a friend at an appointment, and it's very education-based when you're in the appointments, and they like to talk about everything with you, and they right off the bat they say, what are your concerns for today? So you get to kind of list off everything and talk about everything in detail and not feel rushed.
I chose to go with a midwife rather than a doctor because I heard that when you're in labor, they're with you more and they're with you the whole time you're having the baby instead of just at the end. They were so nice, so friendly, and they were so calm at every appointment, and it made you feel super comfortable.
Pregnancy services include prenatal care, healthy pregnancy education and counseling, and support for moms-to-be before, during, and after pregnancy and delivery. Our team also includes a dietitian and an ObGyn physical therapist. Our team invites families and friends to be part of your journey.
We love when patients bring their families to the office, especially the little ones. I like to include them in the visits, whether it be, we're gonna listen to mom's heart, or let's turn on the Doppler to listen to your baby brother or sister. They love doing that.
During pregnancy, you can expect to meet all members of our nurse midwifery team. We deliver babies at Maple Grove Hospital and provide 24/7 care. When you go into labor, our on-call nurse midwife will care for you.
The nurse midwives at Oakdale all work together to take care of their patients. Some of us go to certain clinics, but most of us rotate through all the clinics. And patients can either choose to see a couple of the midwives as they go through their prenatal care, or they may try to see all of us at least once but it is whatever midwife that's on call that would be delivering your baby. So we encourage you to do what's going to be comfortable for you when it comes around to delivery, whether it's just getting to know a couple of the midwives or seeing all the midwives as you go through your prenatal care.
So I didn't just see one nurse midwife when I went to my appointments. I tried to see a lot of them because I knew that there's the possibility that I could see somebody on call that I haven't met before, and that's something that they told me about. So they even suggested, if you feel comfortable, maybe see all of them, and if you feel comfortable with one person or two, maybe see them maybe a little more often if you can.
What I experienced with the midwives when I came into the office for my initial first appointment, of course I was super nervous. My first child, I had no idea, what to expect or, how I would feel going into this process. And the one thing that stood out to me the most was the fact that they were super caring and gave me as much information as I needed, but were able to explain it to me in a way that I felt comfortable about it, especially, like I said, it being my first child. I just wasn't sure what to expect going in. So all of them kind of wanted to just double check and make sure and reiterate, and never hesitated to re-answer some of the same questions I had over and over again. Going into delivery, how they prepared me, because it is my first, I asked a lot of questions. I'm one of those people who I don't have a problem at all expressing concerns or issues throughout the entire 9 months, even all through different midwives that I have met with. Anything that popped up, like in my mind, or if I saw something online, or if I read about something, I asked immediately, and they were able to respond back quickly with the kind of information that I needed throughout the 9 months. So each month, I wasn't so worried about the first trimester, I'm gonna be feeling sick and this and that, or what about swelling in my feet and back, or back aching come the last, few months at the end of it. They were able to kind of explain to me what's gonna happen. And then on top of that too, they had a lot of pamphlets and classes and stuff that were offered to me, so that way if I needed more information, like lactation classes for those who want to breastfeed, which I am one of those who exclusively breastfeed, I was able to try and get myself into a lactation class and sit down and talk with someone and ask questions on top of that too.
In the event of health complications, our nurse midwives work side by side with our OBGYN doctors, both in clinic and during labor and delivery.
Physicians who work with the nurse midwives in the clinic setting and in the hospital setting, we're incredible resources for them. We're able to be utilized by them with questions that may pop up on a daily basis when they're seeing patients. And what's nice about that is when we're working in our office space, we share the office space together. So there's never an inability for a nurse midwife to just, grab a physician if they have a question and ask those questions. When we are on call, there is always both a nurse midwife and a physician on call together. They're both on for a 24-hour shift. The nurse midwives work with their patients, and in the event that they need a physician to help with them at the time of delivery is when we get involved. We're also involved if the patient has high-risk care that we need to know about. And we're called usually if there are some unseen complications or the need to do a delivery that requires what we call an operative delivery, which would be a vacuum delivery or a forceps delivery, or the need to do a C-section.
To learn more about our midwifery approach or to meet our team, visit OakdaleObGyn.com. To make an appointment to meet a member of our team, call 763-587-7000.